everyone, this is Marika and welcome back to another session with me. So we all are discussing the clinical teaching methods and we have discussed the two major clinical teaching method, that is case study and case presentation. Let us quickly recall what a case study is and what a case presentation is. Now, a case study is a form of clinical teaching method that is widely used in all healthcare discipline, in which students are allotted with a patient with a unique health condition. The students are allotted with the patient who have a certain unique health condition. The students get a time period of around 4 to 5 days to study the patient in detail, gather the information about the patient, the information that the student have collected. A student is given and allotted a particular patient. The student studies in detail about the patient, collects all the information from the patient, and finally presents it in front of his or her peer group under the supervision of clinical instructor. The major objective of both of these clinical teaching method is to make sure that the students get the first-hand information from the patient directly, observe the real disease condition in a real patient, and compare the book picture with the actual patient picture. I hope you've clearly understood what a case study is, what are the various purposes, and what are the advantages of case study, and also about case presentation. In this session today, we are going to discuss about another method of teaching, which is nursing rounds. Now, from the term itself, you must be able to understand what nursing round is, right? Let us see in detail what is a nursing round, what are the various purposes, how it is conducted, who are the several members involved in the process of nursing round, what are the various benefits that it has to offer. Now, in simple terms, if I say about nursing round, now nursing round is an excursion in the patient's area which has a motive or which has an aim of students' learning experience. Okay, so a nursing round, it is an excursion in the patient's area with the aim of giving the students a learning experience. In nursing round, generally a small group of people, which may involve the students, the clinical instructor, the ward manager of the particular ward, and the nursing staff, assemble on the patient's bedside and discuss about the disease condition of the patient. Now, this discussion may just not include patient's disease condition. It may include discussion of patient's personal and social history. It may also involve the discussion about all the medical and surgical treatments that are performed on the patient, all the diagnostic procedures that are performed on the patient, and also various nursing interventions that were given to the patient in order to help him recover. Now, as I said, in nursing round, a group of students, right? Few number of students with the clinical instructor, the nurse manager who is the manager of the particular ward, and the bedside nurse usually goes to the patient bedside and discuss about the patient problem, the health status of the patient. Now, what is the use of doing so? Why it is required for the students, for this group to assemble and discuss about the patient? What is the main purpose? So the main purpose of nursing round to see, to assess, and to judge the adequacy of nursing care that has been provided to the patient. Okay, usually nursing rounds are conducted to find out whatever nursing interventions are done on the patient. What are the various nursing care that has been rendered to the patient? How effective was those nursing intervention? Did it help the patient? If it helped, to what extent did it help the patient? And if it did not help, why it did not help? What can be done for the improvement of nursing interventions done on the patient? All right. So to judge the adequacy of nursing care that is provided to the patient, nursing rounds are actually conducted. Now, it is conducted under the leadership of a senior nurse or the nurse administrator, who are also accompanied by the clinical instructor, by the students, and the nurse manager. Okay. So far, we've seen what is a nursing round, right? Why it is conducted and under whose guidance it is conducted. Now, nursing round is basically conducted to see the nursing management, to judge the adequacy of nursing management by sparing some time for each of the patient. So in nursing round, it is not that the group of people who have assembled, the nurse administrator, the staff nurse, the student and the senior nurse does not go to one of the patient. They actually visit each of the patient and see and find out about the adequacy of the nursing management provided to each of the client. Now that we know that in nursing round, the group that has been assembled goes to each of the patient. Few minutes is spared for each of the patients so that the adequacy of the nursing care can be assessed. Now, what is the ideal duration for a nursing round? The ideal duration for any nursing round is about 45 minutes in a particular ward, which is sufficient to cover or to see around 20 to 25 patients. So an ideal nursing round must be for about 45 minutes for a particular ward in which at least 20 to 25 patients must be looked after, or the nursing management provided to those patients, around 20 to 25 patients, must be. The senior nurse with the group of other people involved can find out what are the points to be improved. All right. To have a successful nursing round, the students have to have a proper knowledge about all the patients in the ward. So basically, nursing round is conducted to make sure that the students are well aware about the patient, their condition, what is their progress, and what kind of nursing care is provided to specific patient with a particular disease condition. So this is a learning process for the students. So in order to make sure that the nursing round is successful, students must possess a little background knowledge about each of the patient in the ward. While the students and the nursing staffs are on nursing round, it has to be ensured that the patient's privacy, that the patient's dignity is preserved throughout the nursing round. The time for nursing rounds that are to be conducted in each of the ward must be well informed to the students. So all the students who are involved in nursing rounds for a particular ward must know what time the round starts. The ideal time is 45 minutes. The students must be aware about what is the actual time when they have to go for the rounds. All right. In nursing round, the teacher or the head nurse or the nurse in charge who has a proper and thorough knowledge about all the patient will actually brief the nursing care that has been provided for each of the patient. Now, as I said, the nurse in charge usually briefs all the nursing care that is provided to the patient, but the students also have been allotted with different patients in the ward, right? So the students also gets to contribute their point. The students also get the opportunity to contribute their point related to a particular patient whom they are allotted with. A staff nurse who is in charge of the particular patient briefs the entire nursing care that has been provided from the start to the patient and what are the improvements. The students may also have been a part of patient care. The students also have provided nursing care to the particular patient. So the students also will get the opportunity to contribute their points, and they will also have to answer the questions asked about the patient. Once the nurse and the student who are allotted with the patient briefs about the nursing care, the particular patient and the health condition of the patient, the progress of the patient is taken for discussion. The discussion mainly involves nursing aspects. Once the discussion is done, the senior nurse helps to improve the nursing care that has been provided to the patient by contributing her points, giving advice and guidance to the staff nurse and the students involved. One of the staff who is involved in patient care and is a part of the particular ward records every advice and points to be improved that is given by the nursing administrator in the ward register that is maintained in each and every ward. All right. And then the group moves on to the next patient. So basically, in a nursing round, A group is formed who goes for a round in each of the wards in order to assess the adequacy of nursing care that has been provided to the client. In this, the staff nurse who is in charge actually presents the case of the patient and also actually focuses on the nursing care that has been provided to the client. The student who is also involved in providing care to the patient also contributes genuine points. Now, the nurse administrator or the senior nurse actually gives advice and points to be improved for the particular patient. One staff nurse is assigned with the responsibility of recording all the guidance and advice that has been provided by the nurse administrator in the ward register. Once this entire process is done for a particular patient, they move on to the next patient. I hope you've understood what is a nursing round. Now let us see what are the various purposes of nursing rounds. The first purpose is to acquaint the staff and the nursing students with all the patient in the ward. Acquainting the staff and students about the patient involves knowing everything in detail about the patient, from his disease condition to the diagnostic test that has been conducted on the patient, the medication that patient is under, the surgical treatment that has been done for the patient, the complications that might have arisen after any kind of treatment, and nursing care especially. The next one is to demonstrate the clinical feature of a specific disease condition. As I said, we study everything in theory. Whatever we have studied is in our books, and the book picture and the patient picture obviously differs. So in order to demonstrate the clinical feature that actually is seen on a real patient, nursing rounds are used. To find out the clinical features or to actually see the clinical feature is carried out so that proper nursing interventions can be planned for the specific patient. When we have studied in the book, we study a particular disease condition and we study the symptoms, general symptoms that might occur in all the patient. But every patient is different. The symptoms may vary from one patient to another. So to plan an individualized specific nursing care, we need to see and understand the clinical feature each of the patient actually shows, right? To demonstrate those clinical features in the patient is why nursing rounds are conducted. Next one is to clarify the terminology studied. Whatever we have studied theoretically, the terminologies that we have studied, to clarify those terminologies when we go for a clinical nursing round, it helps the student understand those terminologies better. Next one is to study the patient's reaction towards the disease and to understand and study the disease condition better. The next purpose of nursing round is also to demonstrate the effect of drugs, to find out how effective a drug is or what are the different adverse effects that are caused by a certain drug that is administered on a patient with a specific disease. Alright, so to find out the effects of the drugs, the positive effects as well as the adverse effects of the drugs, nursing round can be used. To plan and illustrate skillful nursing care. Of course, nursing rounds are conducted to judge the adequacy, to judge the effectiveness of the nursing care, right? So to plan and illustrate how nursing care must be provided to a patient with a specific disease, nursing rounds are conducted so that the students can see how effective those interventions in nursing care are. The next purpose is to promote team development and professionalism among nurses. It will also help the nurses facilitate the skills of handing over the patient to the nurse who is in charge of the particular patient. It will also help the nurses who are working towards the betterment of the patient, towards the well-being of the patient, to hand over the duties to one another whenever they are responsible or whenever they are in charge. The students also develop the ability to categorize the patient into high risk, low risk, and the medium risk patient. The students get the opportunity to go visit each of the patients, see the disease condition, see the severity of the particular disease condition the patient is suffering from. So this will give idea to the students what high-risk patients are, how to categorize the patient into high-risk patient, moderate-risk patient, and a low-risk patient. Now, another purpose of a nursing round is this provides the students with the opportunity to see the progress of the patient through an experienced nursing expert. So as I said, in nursing round, the nursing professionals go on a round. They discuss about the progress of the patient, especially about the nursing care that has been provided to the patient. Here the students are getting the opportunity to actually see the nursing care that has been provided by experienced nursing staff, and also the improvements to be brought in the patient that has been given by a nursing administrator. Nursing rounds also provide the opportunity for the students to see various aspects involved in patient care, such as medical and surgical treatment, the changes that are made in the medical surgical treatment of the patient according to the progress that has been seen in the patient, various nursing interventions that has been carried out to the patient in order to help him gain his recovery, effects of different drug treatment modalities, and nursing management. Another purpose of nursing round is that it also facilitates learning about various different patients in a short period of time. So these are the various purposes of a nursing round. While we discuss the purposes, it also involves various points that serves as a benefit of nursing round or advantages of nursing rounds, right? Let us now see what are the disadvantages of nursing round. The first disadvantage is that, as I said, in nursing round, few number of people can go for rounds, right? So it is not an effective method of teaching for a large group of students. Only few number of students can be selected. Along with the student, there will be staff nurse involved, there will be nursing administrator involved, and there will be clinical instructor involved. So it is not a useful method of when large group of students are involved. After the nurse has presented the nursing care rendered to the patient, there is a discussion that is held on the bedside. Now the discussion that is held, group of nursing professionals might make the patient uncomfortable, and the patient may feel some kind of discomfort when his disease condition is being discussed, which may also lead to anxiety. Another disadvantage of a nursing round for the staff nurses who are not actually involved in the direct or indirect care of the patient is that it might be a waste of time for them. If I am one of the staff nurse who's working in the ward, but I am not involved in providing care to the particular patient, for those kind of staff nurses, it might just be a waste of time. It might just be a waste of time as they get to know information about the patient. They do not have a contact with the patient, or they are not involved in providing care to the patient, right? Knowing all those information about the particular patient might not be helpful for those staff nurses. So that is it for today's class. In this session, we have discussed about what is a nursing round and basically what are the different purposes and advantages and disadvantages of a nursing round. In nursing round, few number of nursing students along with the staff nurse, the clinical instructor, and the nursing administrator goes on a round in the ward, right? The ideal time that is taken for a particular ward is 45 minutes, in which 20 to 25 patients are actually covered. The nurse who is directly involved in patient care describes about the nursing care provided to the patient. The students also get the opportunity to contribute few points. Now, once this is done, the nurse administrator gives her advice to the nursing students and the nursing staff how they can improve the nursing care provided to the patient. Once this is done, they move on to the next patient and the same is carried forward. There are various advantages, yet there are few disadvantages of this procedure. Major disadvantage for the students involved, only few number of students can be a part of nursing round. So to cover a large group of students, it might be difficult. And the main disadvantage for the clinical staff or the nursing staff is that if she is directly not involved in providing care to a particular patient, it might be a waste of time for that particular nursing staff. I hope the class was helpful and I'll see you all in the next session. Thank you and have a great day.